Researchers are sounding the alarm on a rise in cannabis-related emergency room visits by pregnant women. A recent study in the Canadian Medical Association Journal found the rate of hospital visits by pregnant people who used cannabis nearly doubled to 20 per 100,000 pregnancies. Now, this is up from 11 per 100,000 since cannabis legalization. Lead researcher Dr. Daniel Myron of the Ottawa Hospital says while the absolute rise in ER visits and hospitalizations is low, many more people could be using cannabis during pregnancy. He says many of those may not land in hospital, but their babies may also be at risk for developmental issues. Well, joining us now to unpack the concerns and risks associated with cannabis use during pregnancy is Dr. James MacKillop, a psychiatry and behavioral neurosciences professor at McMaster University. He is also the director of the DeGroote Center for Medicinal Cannabis Research. Dr. MacKillop, welcome to Forum Daily.
Great to be with you.
Now, cannabis is said to be the most commonly used illicit drug during pregnancy. So what is behind this increase in pregnant women using cannabis in Canada? Is it just legalization, or are there other factors at play here?
Well, one thing we have to be aware of is that nausea during pregnancy is very unpleasant, and many women are seeking better relief for nausea and are considering many different options. And increasingly, it seems like we're seeing women turning to cannabis. Part of that may be because people are perceiving cannabis to be more benign following legalization. That's not necessarily the case.
And what do we know so far about the impact that cannabis use could have on the development of a fetus?
Well, what we know is that whatever mom ingests, the fetus largely ingests too. So when moms are consuming cannabis, a portion of the THC in the cannabis and the CBD, for that matter, too, is entering the fetus also. We know it has a wide variety of effects on the developing baby, and what we also know is that post pregnancy, there are associations with a number of conditions, especially conditions like autism and ADHD, among children who are exposed to cannabis in utero.
I would love to hear a little bit more about that. We know legalization is relatively recent. It started in 2018, but can you tell us a little bit more about the long-term impact on a baby's growth and development into a child or young adult following exposure to cannabis during pregnancy?
Absolutely. Even though legalization is relatively recent, we know that moms have been using cannabis during pregnancy for many years. And the reality is, we've been able to do long term longitudinal studies following up on individuals who've been exposed to cannabis and understanding some of the consequences. And these tend to be quite wide ranging. They range from effects on cognitive ability, intellectual functioning, school achievement, to the presence of psychiatric conditions like ADHD or autism. And that latter association is one of the most robust, that individuals who are exposed to cannabis during pregnancy have a much higher rate of developing autism later in life.
All right, I want to look at the numbers here. According to the study, which looks at over 980,000 pregnancies in Ontario, 540 people visited the ER or hospital after using cannabis. So, what do we know so far about the symptoms and reactions they had to lead them to the emergency room?
Well, the reality is, as the researcher described, that the absolute numbers here are quite low, right? So it's not that large numbers of women who are using cannabis are going to the emergency department, and we don't really know a lot of the details around those admissions. But what's a little troubling is the almost double the rate over time. And that suggests that maybe what we're seeing is a canary in a coal mine, so to speak. That is, maybe many more women are using cannabis during pregnancy, and as a result, the rate of women who are experiencing a serious negative consequence and that leads them to go to the emergency department is going up surprisingly largely.
Some concerning information there for sure. Now, what about postpartum use of cannabis? How does that impact both the mother and the baby, especially if the mother is breastfeeding?
Well, what we know also is that cannabis passes into the breast milk, and as a result, for moms who are using cannabis postpartum and breastfeeding, the new baby may be consuming cannabis that way also. As a result, it unfortunately can be another risk factor all the way across the peripartum period.
All right, Dr. MacKillop, we've got about 30 seconds left here, but let's talk about solutions. So, what are some real solutions to this issue to prevent more cannabis use during pregnancy in Canada?
Well, I think it's really important that we do as much education and knowledge translation as possible so that pregnant and postpartum women know the risks. I think that the reality is that, from what we can tell, none is best for during pregnancy and postpartum. But certainly for people who feel like they really need to use cannabis, less is more. Less cannabis means more health benefit for the developing baby and the baby postpartum. And the reality is, it's really important to work with healthcare providers because for someone suffering from morning sickness or other peripartum conditions, there are other options, and hopefully, some of those options can control those symptoms and minimize the need to use cannabis.
Dr. MacKillop, thank you again for your time today.